Hello, my name is Corey Langer. I'm professor of medicine, Abramson Cancer Center, University of Pennsylvania in Philadelphia, and it's my privilege to talk about two very important presentations in small cell carcinoma of the lung at ASCo 2016. First was the long-awaited CONVERT trial from Europe, a phase 3 trial in limited small cell comparing once daily to twice daily or b.i.d. radiation in context of systemic treatment with etoposide and platinum. Many remember back to the late 90s when the Turrisi regimen, looking at twice daily RT over 3 weeks, 45 gray, combined with standard chemotherapy, etoposide and platinum for 4 cycles, proved superior to standard once daily radiation at a similar dose of 45 gray. That trial was called into question, that these were in fact not biologically equivalent doses, and so the CONVERT trial from Europe attempted to remedy this issue, comparing 45 b.i.d. over 30 fractions to a biologically equivalent dose of 66 gray over 33 fractions, with treatment with radiation started during cycle 2. Beyond that, the regimens were very similar to the original Turrisi effort. Cisplatin was dosed at 75 milligrams per meter squared day 1, or broken up into 25 per meter squared days 1, 2, and 3, along with the etoposide, 100 milligrams per meter squared days 1, 2, and 3. The final endpoint in this trial, as it should have been, was overall survival. This study was large. Over 540 patients were randomized. Both arms were well-balanced demographically. The vast majority were former smokers, all but 3% had good performance status, ECOG PA 0 or 1. Treatment delivery was generally quite good in both arms, although intriguingly a bit superior for the twice-daily arm, 98% getting the target dose compared to 83% in the once-daily arm. There was no significant difference in survival. The p-value was 0.15, although it should be noted that the twice-daily arm resulted in a 2-year survival rate of 56% compared to 51% in the once-daily arm. It was concluded by Favre Finn, the PI of the trial, that this effort gave justification for once daily over twice daily. I'm not sure I agree with that conclusion. The trial ultimately was underpowered to show a major survival difference, and their original statistical premise was that once daily would actually be better than twice daily, and that certainly wasn't proven. Median survival difference was about 5 months, favoring the twice daily approach. The 2-year survival rate was 5% higher. So between the Turrisi effort, the phase 3 effort centered to North America, and this effort, one could potentially argue that twice daily is still the standard, although certainly a debate could ensue based on this effort. The second trial, completely unrelated to this, was an evaluation of a novel immunoconjugate, Rovalpituzumab, in the second and third line setting. This is a targeted antibody drug conjugate that specifically addresses delta protein on recurrent or refractory small cell. By and large, in patients with extensive disease who enjoy a disease response, those responses are frequently relatively short-lived, no more than 4, 6, 8 months, and in the recurrent or refractory setting, we have very few active agents, with topotecan the standard. So this trial specifically, first-in-human effort, looked at both small cell and neuroendocrine tumors. It was a dose expansion trial, finally settling on a phase 2 dose of 0.3 mg per kg, 6 weeks apart for 2 doses. 74 patients were enrolled. The majority had chemosensitive reaction to first-line treatment, so chemosensitive relapse, although it should be noted 40% had either resistant or refractory disease. Major side effects included thrombocytopenia, serous effusions, and some skin reaction. But of note, the response rate here was 18%, and those with delta protein expression 50% or higher, it was 39%. The clinical benefit response was nearly 90% in that group. A central review essentially validated these responses. Intriguingly and paradoxically, the response rates were actually somewhat higher in the third-line setting rather than the second-line setting. For those with delta protein expression above 50%, the response rate was 50% in third-line and 29% in the second-line. Median overall survival for those with greater than 50% expression was 5.8 months, and one-year survival rate 32%. This agent is now being studied prospectively in a major phase 2 trial to determine its actual activity. And I think based on this effort, assuming the phase 2 trial confirms the data from the phase 1, we will have a new agent to use in this setting, possibly the first targeted agent in the management of small cell. This is highly promising. Again, the PFS and overall survivals could be a bit more impressive, but the response rate in this setting is much higher than any agent we have used historically. Thank you very much for your attention.